if someone's experiencing depression and they're kind of nervous about therapy, maybe they've heard a lot or known people who went and wasn't really sure if that's something that they wanted to do, what would you tell them?
Well, I think the way I work, and I think the way that we are oriented to work with folks here, is to really not necessarily do things the way people expected them in the past. Maybe they had other experiences. Maybe they work with people who stressed one thing or another, stressed doing exercise a certain way, or they had to do the work together in a certain way, had certain expectations. We're more interested, I think, in doing what we do to liberate people, to help them feel empowered, help them feel strong in ways that matter to them. And it doesn't necessarily have to go in ways what they've heard about therapy. There's so many things out there in the popular culture, in movies and television, about how this is done, ranging from lying on the couch to folks jumping into pools or being rebirthed from a barrel of water. I mean, we hear all kinds of things about what people try out there to, feel stronger and feel more hopeful and reduce some of their sadness and feeling blue and feeling anxious in the world. We don't have any notion that it has to be based on what they've already experienced. So they may have friends telling them all kinds of things about what they've experienced in therapy, and part of what we're doing is we want to individualize what we do to help people feel stronger and liberated and freed up from the things that have held them back. It may come in a very different form than what they've heard their friends go through. So we really want to customize and individualize what we do, and it may be very different. It may not even seem like therapy as they've seen it and heard it portrayed elsewhere.